Well, we're going to get started. Welcome, everyone. It's my pleasure to have you here for this evening where we are going to start the process of unveiling the data that we have pulled together so far to describe our criminal justice system here in Benton County as part of our overall criminal justice systems assessment. The team of CGL and GOBHI, our project management team, has worked really hard over this last week, and we've had a lot of great discussions. And I'm hoping that this will be yet another really good discussion as we unpack what we are finding about our system and how it's working now, and step forward to make some decisions about what our three alternatives will look like for our report and potential implementation in future. I wanted to comment that we are recording tonight. We are using a video recorder as well as audio recording, and when we turn to question and answer, we will get a mic to you so that you can speak into the microphone so that we can keep track of these questions and make sure that we don't lose any of your comments and questions as we move forward. And with that, I am going to pass the baton on to Ari Basil-Wagner, who is going to give us the launch for this evening, and then we will get right into the program. The program will take probably about an hour and a quarter. It depends on how many questions we have. Could take an hour and a half. We have some great interactive pieces as well, and so looking forward to a great discussion.
Thank you, Commissioner. I'm Ari Basil-Wagner. I'm the Director of Organizational Development at the Center of Excellence on Behavioral Health and Justice Integration. And I want to start with a big thank you to all of you who made time in your day from work and family to come here tonight and learn what we're finding out about in the assessment. So I humbly wanted to start with that gratitude to you all. I just take a minute to talk to you about who's in the room from our organization, and then Karl, of course, introduce you and your work with CGL. The Center of Behavioral Health and Justice Integration's goal is to help divert people from the correction system who have mental illness and addictions, or for people who are in it to get the treatment they need to better be stable in the community when they leave the system. And so some of the expertise in the room that helps support that is our director, Janet Holland, who I thought was in the room. She looks a little bit like me, but taller. Kelly Keith is on keyboard, who is our IT guru. And we have a manager from Trauma-Informed Care. That interrelationship between trauma and later behavioral health issues is huge. So we have that expertise with Dina Seitz, who is the manager. Hi, Dina. And Jennifer Simeon, who is another project manager and who's great at helping to keep track of all the details of this project. And Dr. Jorge Ramirez, who is our researcher with the center. And there are even more people behind the scenes helping to do this work for your community. Before I go into the agenda, though, I want Karl, you to have the opportunity to talk about your staff and who's involved with CGL so folks know who's up here tonight.
Again, my name's Karl Becker. I'm the project manager from CGL on this engagement. We have a variety of staff working on this. We're spread out all over the place on a number of different projects, so they couldn't be here tonight. But Cameron Glass, Paul Vanar, Chris Monsma, Brad says there's about 4 or 5 people that we have behind the scenes looking at your data, looking at what's going on here. So although I'm the face of what's going on and presenting the data tonight, trust me, I didn't do this work. This is being done by a lot of very dedicated people who really know what they're doing.
Thank you, Karl. All right, well, let's get started. Your agenda includes this welcome. Very heartfelt that you're all here. We're going to go over briefly the objectives for people who are not familiar with why this is occurring, why this, why now. Karl will present the analysis of the data that's been collected so far. I'm going to go over data regarding community feedback that we've had in community meetings. And then we're going to have a bit of a community engagement time with you all. And we're going to use the instant polling tool for that part, so you'll all be able to take part in some questions and answers anonymously, and we'll see what the room thinks about some of this work that we're doing. Sound good? You're all still sitting, so that's good. All right. So just a quick introduction. This is a collaborative effort. Not any one organization can look at all of this on their own. You, the Benton County community, are in the center of this work. Your input, from citizens, providers, people working in the system. I see some of you back there. Hello, gentlemen. Glad you're here, too. People with lived experiences who have been in the jail, who have graduated from drug court. Victims, talking about what they think. All of you are part of this, as is CGL and the resources they bring, and as you've seen, some of our resources. So I just wanted to show that collaborative visual. The objectives are to identify the most effective correctional system for Benton County in what works. And that's done through data analyses. Let me just show you what that's done through. This might be good time to go here. The inputs, what are we collecting? So there is the quantitative data. We're looking at information, and CGL is collecting all this and doing that analysis regarding offenders, their rates, frequencies, type of crimes, demographics. They're looking at their needs. What are some prevention efforts and diversion efforts? They're also looking at court processing, what happens through the entire system, jail data, probation and parole, policies, system mapping. I hope you're getting a sense right away, as that visual in the back of the room shows. This isn't a single focused analysis like many are when you look at the system of corrections. It's comprehensive. So we're taking all those data and mixing it with community engagement. Feedback from community members on your vision of what you think would work for Benton County. Victims' needs. You have hard data, community input, and the other bucket is a literature review on what works. What helps to divert people, what helps offenders not reoffend, what helps people who have mental illness and addiction issues, and sometimes both, to be more successful from diverting from the system or leaving it, more capable of living in a stable life. So we're looking at that literature and the literature on social determinants of health. The interplay between crime, community safety, housing, transportation, violence, food, access to treatment. So you have all these types of information that will be synthesized together, and the output of that is going to be 3 options for Benton County to consider based on all of the above. And those options will include cost-benefit analyses. We're going to start with the higher level view of that map. It's very detailed back there, but a higher level view. And Karl will start us off with going through that. So Karl, I'm going to hand you here, I think I run and I do it like this. That's what happens.
Okay. Thanks, Ari. Before we do any analysis like this, our goal, our methodology is that we're very careful that we make no judgments in terms of how the system's performing until we get a good sense of what the system looks like and how it functions. So to that end, we've collected a bunch of data what we're going to talk about later in terms of what the system looks like. But our first step was to really try to get an understanding of how the system operates, how people flow through the system, how efficient the system is in processing people through the different justice agencies, what opportunities are there for interventions along the way for people to either fall in or fall out of a different program. So to that end, we've spent a lot of time talking to the different actors in the systems, trying to document how the system actually works. We're about 90% of the way there, and you'll see back in the corner as our draft map of how the system actually operates, and it'll show you essentially the different paths that people can take as they migrate through the justice system through the different agencies. It's fairly detailed. We've got more to add to it, and it's a work in progress. But what I have for you here is basically a high-level summary of the different phases that we break the justice system down into for the purposes of our analysis. And really, the most important takeaway from this really high-level overview is it starts with the community, where the people come into the system, and it ends with the community, because they exit the system at some point and go back. So what we want to see is how effective the system is in returning people to the community with low risk for recidivism, with the potential to be productive citizens, and getting them back to society as safely and as effectively as possible. So it starts with the community and it ends with the community. From first step in the system, of course, is system entry. How do people enter the system? We'll look at, for the purposes of our analysis, we look at arrests. What the policies are in terms of enforcement of laws, how people are taken into custody, cite and release, how people are diverted from the system, warnings. We're going to get it. We'll try to identify how people actually come into the system and how your law enforcement agencies intervene in criminal situations, and that results in people entering the system. Then, of course, they go to the jail, and then we look at basically what factors determine whether that person gets to go through the jail system or not. Are they cited and released there? Are they kicked out? Is the jail full? Are they subject to matrix release? Are there different holds put on them? How are they classified? How are they interviewed? How are they assessed for what their needs are as they enter the jail system? That's the booking process. The DA then will look at, in terms of his review of the cases as they enter his office, how they're charged as felonies or misdemeanors, how they're processed through the jury system. Initial court filings follow, where the actual felony and misdemeanor charges are filed, and then that follows into the arraignment process and the pretrial process. So we'll look at how, again, those decisions are made at that stage and how people fall into the different buckets that are available to the filing process at that stage. We'll also look at the aid and assist process for people that have mental health issues. They need to be restored to competency before they can stand trial, and what that process looks like, and how those people are diverted through that system, and how long that takes. Pretrial hearings, this is where the pleas are held, are heard, bail is set, decisions made on aid and assist, not guilty pleas being made. So we'll look and see how, again, people fall through those different categories. Collaborative court is an option here in Benton County. You have a drug court, so good candidates for the drug court are identified at this point in the process, and subject to the rules of the program, they can participate in that program and get their sentence suspended and receive treatment subject to the rules of the program. So we'll look and see how those people are identified, what their success rates are, what the recidivism rate is, and what happens to the people that actually fall out of the program. Trial is another step in the process, jury trial or bench trial. Again, felony or misdemeanor, so we'll look and see how cases fall through there, how long it takes to get to trial, and what the numbers are in that stage of the process. After a sentence, after a verdict, I should say, there's a pre-sentence investigation where the background of the case, the background of the offender is examined, and a recommendation made to the court in terms of what that sentence needs to be. We'll look at that process. And then sentencing. What the options are for felons and misdemeanors as they become sentenced: prison, jail, probation, restitution, work crews, fines, suspension of licenses. There's a variety of different sanctions, and we'll look and see how people fall into those categories. So that's a real high-level view of the different stages in the process and the type of data that we're going to be taking a look at. What's the outcome of all this? What goes behind that process? So this is some of the initial data we've come up with. So we first wanted to get a handle on crime and criminal activity in Benton County. So this is a look at adult arrests in Benton County for the last 10 years by arresting agency. The lower blue bar is the Corvallis Police Department, the red bar is the Benton County Sheriff's Office, and Philomath is the small black bar on top. And you can see that over the last 10 years, you've had about a 23% increase in the number of arrests by these agencies, most of which occurred through 2014. Since 2014, basically the data has been fairly stagnant. Just for purpose of comparison, the state of Oregon's adult arrests have fallen by about 50% during the same time period. So yours have gone up. The state of Oregon's has basically fallen by about half, which is just to say that you're not the same profile as the entire state. You have a very specific, unique situation here in Benton County. Juvenile arrests have fallen. They're down by about 47%. Most of that reduction occurred through 2012, and with some variation, it's been about the same ever since. One of the interesting patterns we see here is that most of the decline in arrests was from the Corvallis Police Department. Arrests by the Sheriff's Office have been relatively steady. Most of the reduction in arrests has taken place in Corvallis. And again, by way of comparison, statewide juvenile arrests are down 75% in Oregon over the same time period. Looking at arrests by category of crime, so we looked at what agencies are making the arrests. This looks at the type of crimes that the arrests are being made for. This is a closer look at the last 5 years. So you see the largest categories, the bottom bar, those are behavioral crime arrests. Behavioral crimes are social crimes, drug law violations, prostitution, DUI, liquor laws, disorderly conduct, gambling, those type of offenses. They make up the single largest category of arrests. Property crimes are the red bar in between, significant number there, and then on top you have person crime arrests. The interesting thing here that you'll note is that while arrests have gone down overall, the number of arrests for person crimes has gone up somewhat since 2013. A person crime is a crime where there's either an act of violence or a potential act of violence against another individual. Murder, rape, aggravated battery, those types of offenses. Typically serious felonies. What are the outcomes of these arrests? So we saw what the overall arrest data looks like. What happens to people when they get arrested in Benton County? So this is data from the Sheriff's Office and Corvallis Police Department for 2017. And about 67%, about 2/3 of the arrests result in a commitment or a booking into the jail. Most of those are for jailings on new offenses. About 7% are jailed on an outstanding warrant. But what that also means is that about 1/3 of all people arrested are cited and released, basically given a citation and told to show up for a hearing later on in the court. They are not booked into the jail. Looking at offenses now, these are reported offenses. We've been talking about arrests so far. These are reported crimes. So these are reports of crimes into the law enforcement agencies. And the first thing you'll notice is there's a lot more reported offenses than there are actual arrests, about 3 times as many. But you see the same basic pattern. Property crimes below, middle bars, behavioral crimes, and then the smaller number of actual person crimes. And again, you see the pattern where the number of reported offenses for person crimes is increasing. What we next wanted to do is look at how Benton County compares with other counties along some of these same metrics. So the first thing we looked at was reported offenses, reported crimes per 1,000 population for these counties, which we picked basically because the population level was roughly comparable to Benton. In the case of Lane County, we included that because they have obviously a major university there, so it's comparable in that respect. And on the top, you see the state of Oregon's rate. So what this tells you is that actually Benton County had the highest rate of reported crimes of any jurisdiction we looked at. About 91 reported offenses per 1,000 population. Very close to Lane, interestingly, the other county with a major university. The other small counties all were substantially less. State of Oregon, about half the rate what you have in Benton County. Looking at the same counties for arrests, we see there Lane County has a much higher rate of arrest than Benton. And Yamhill and Polk and Benton are all basically in the same territory in terms of the number of arrests, the number of basically the activity by the police in responding to those offenses. And again, the state of Oregon's rate is much lower than what is experienced in Benton. Linn County, you're going to see throughout this, is kind of an outlier. They have very low arrest rates, very low offense rates, and relatively high numbers of officers. We looked at the resources you put in your criminal justice system. This is a graphic on the number of sworn officers, police officers for all your law enforcement agencies in the county per 1,000 population. And you'll see basically, again, Lane, Benton, Lincoln, Yamhill, they're all in the same territory, between about 1.6 per 1,000. They're all very close. Lynn is very high, Polk is very low. This is the same look, but looking at crimes, reported crimes in the jurisdiction per officer. And again, Lane and Benton are very close, Polk is high, Lynn is very low. So we're seeing a pretty similar pattern. This is the outlier here. So you've seen before in the prior slides, relatively high rates of arrests, relatively high rates of reported crimes for Benton County relative to the other jurisdictions we compare to. This is county jail capacity. And you can see Benton has, and this is just the capacity of the jail here in Corvallis, capacity of 40. And you see the comparison, Lane with 407, Yamhill 259, Polk 195. They're all far, far, far greater capacities than the capacity you have here in Benton. Looking at incarceration rates. So what this is the actual number of people you have in custody. So this would include people you send out of the county on contract. This is the incarceration rate per 1,000 population. And again, Benton is by far the lowest at 0.69. I believe it's the lowest in the state of Oregon. I will say we do a lot of this type of analysis around the country, and this is the lowest incarceration rate for any county I've ever seen. That's not to say that's bad, good, or indifferent. We don't know that yet. But typically what this would tell you is that there's very little crime in the county, or there's a extensive network of alternatives to keep people out of the jail. So that's the next step in our analysis. But the important takeaway from this is that your incarceration rate and your jail capacity in Benton is way low relative to what we normally see. Criminal filings, this is kind of basically a function of the capacity of your judicial system, judicial agencies to process people through. So crimes and arrests will vary somewhat. Filings will be more stable just because the system can only file people through and process people through at a certain rate. So it's fairly stable. Again, the majority are misdemeanors, which are the bottom bar. Felony filings are on top. This graphic shows you the percentage of people that fail to appear at their criminal hearing. They've been released on bail, they've been issued a citation and told to show up to court, and this number don't show up. This is a very high number. Typically, we would expect to see this at no more than 5% for most jurisdictions. So you see here in Benton County, it's been as low as 14% in 2014. It was 16.3 in 2017. And what this tells us is that either there are people that are being released who should be kept in jail because they can't be trusted to show up for their hearing, or that there's no consequences for them not to show up. So there's no incentive for them to show up. So this is an indication that there's something going wrong in your system. Average daily jail population. So again, this is no surprise to anybody. It's very stable because you have basically a limited capacity to house people. The capacity in the jail here in Corvallis is 40. The population is averaged around 30, as you can see, for the last 5 years. And that's because you have to reserve beds for females. Inmates that take special custody, it's very rare that you'll have the ability to fill all those beds. So the balance of the people you need to incarcerate go away on contract. Different jurisdictions 3 or 4 years ago, Norcor more recently. But you can see that more than half of the jail population is housed out of the county. Jail admissions, again, this is basically a function of the crime rate and the arrests, and follows basically that pattern. The interesting thing here is how jail admissions relate to length of stay. And what this shows you, this is the number of, this is every person that was in the jail and released in 2017. Around 2,000 people were released. And what this shows you is that about half of them were released after 1 day in jail. About 75% were released within 2 weeks. So there's a lot of churn, a lot of churn. Only 11 people were released had served more than 6 months. This, what you need to keep in mind with this, sorry? Oh. Yeah. Release from the system. Release, yeah. Yeah. So what the takeaway here, though, is that there are still a large number of people in the jail system serving extensive time, pending trial, serving sentences, and they tend to sit in jail. So because of your limited capacity, they take up the limited beds that you have, and so people coming into the system, there's simply no room for them, so that's why you see the accelerated release very early on in the process. Some of these people, if capacity was available, may have longer stays. We don't know that. We need to take a look at that data, and we'll do that research. But what this obviously tells you is that there's a lot of activity processing people in and out of the jail, and that creates work for police, creates work for jail staff. So it's a strain on your system. We've all heard a lot about forced releases. So this is the pattern of people forced release from jail from the last 5 years by month. So forced release occurs when the jail is full and can't take any more people in, and there's not an ability to move them to a contract bed. And they're released pursuant to a matrix. So you can see it fluctuates fairly between a range of 0 to 20 for most of this period of time. And then in January of 2017, it spikes, and then it has spiked again in May, and basically is staying at that higher level. So it's still fluctuating, but it's staying at a much higher level right now. So forced releases are averaging now on the order of 30 to 40 a month, whereas before they were averaging 10 to 20 a month. A good number of these individuals, especially more recently, are repeats. So a person will be released, arrested, picked up again, released again. So you'll see, for example, in September, you had 9 people that were released repeated times during the same month. So again, a kind of a revolving door situation. This chart looks at what your jail population would be if you had no forced releases. And what you see is that up until, again, about 2017, there's not a lot of impact. And the reason for that is the people that were forced release had very little time that they would have normally spent in the jail. They were very low-level offenders. You're saving a couple days off of their time in jail, so it doesn't have a big impact on the average population. However, as you get into 2017, because you've had to release more and more people, you're releasing more people with more time to serve, so the impact becomes much, much greater. So if you had kept people in that you had early released, you would have had a jail population of over 75 by the end of the year, as opposed to in the 60s, which is what you had. Looking a little bit more at the people that were in the jail. This is a profile of the population by ethnic background. So you can see we have and we put, for purposes of comparison, the county profile, demographics. A note of caution here, the jail doesn't house only people from Benton County. There are people from other counties housed in the jail. So comparing jail demographic breakdown to county demographic breakdown isn't a one-to-one comparison. It's kind of an apples and oranges way to look at things. We'll try to get data on exactly how many people in the county jail system are from outside of the counties, but we don't have that information quite yet. But it generally follows the county demographics: 79% white, 8% Hispanic, African Americans are overrepresented in the jail population, and so on. This is the jail population broken down by age group. The vast majority are 26 to 45. The average age is 34. This is a little old for a jail population. Typically, we would see jail populations averaging in the late 20s, mid to late 20s. So this was a little bit of a surprise. It's a little bit older population, which again is surprising because you're a college town. You would expect this to be a little bit younger. Breakdown by gender: 15% female, 85% male. This is, again, this is a little high on the female side. Typically, we see jail populations of around 10 to 12% female. This creates problems, again, for your capacity in the jail here in Corvallis, because you've got a significant number of female offenders. You've got to reserve those beds because they can't be housed, obviously, with males. When you've got limited resources, having to carve out that number of beds for females creates issues. Legal status, nearly 60% are in pretrial status, with the balance 40% sentenced. That's a fairly typical profile. The significance here is that your sentenced population is around 24, given where your total population is right now. So that's your universe of people that you can send to NORCOR. Because, as I understand it, unless they waive the right to be housed here in Benton County, only sentenced offenders will be sent out of the county to the contract bed facility. So that limits your ability to send people out of the county. So as a result, you've got on the order of 35 to 40 bed population right now that has to be housed in Benton County, and with the number of beds you have here, that's going to mean increased forced releases. We did a little bit of look at data on offenders' needs, health needs based on treatment and prescriptions at the jail. So one of the things that you've all heard about, no doubt, and something we see in jails across the country, an increasing problem of the mentally ill incarcerated, and the need to deal with their issues and treat them and make sure that they have access to therapeutic medications and treatment to restore them to some level of competency. Right now, according to the data we have, about 35% of pharmaceutical expenditures in the jail go towards psychotropics, and no other medication even comes close. So over a third of what you spend on medicine at the jail goes for psychotropic medications, which is high. And this basically shows you, again, the distribution of prescriptions at the jail, the overwhelming majority, again, going to psychotropics. That's the number of prescriptions. We also took a look at program needs, and the inmates that you send in NORCOR, basically, they receive an assessment of their program needs. They're assessed first with the LSIR. That's a level of service inventory instrument. And what that instrument does is it does a fairly detailed examination of the inmate and takes a look at their program needs, their risk to reoffend, and their responsivity to potential treatment. And based on that examination, they'll score them into 3 buckets, low, medium, or maximum. And the goal of the instrument is to ensure that those inmates that are judged in maximum need of programming receive the resources. One of the principles of correctional programming is you get the best bang for the buck by ensuring that your program resources are allocated to those inmates with the greatest need. You don't want to waste your resources on inmates that may not profit from them because they don't have those as significant need anyway. So of the inmates sent to NORCOR, you can see there were about 111 that were assessed, 22 were in the maximum category, 71 medium, and 18 were low. And then at NORCOR, those inmates were referred to, 24 were referred for mental health services, 17 for medications, 5 were actually referred to the residential inpatient mental health unit, and then 34 were referred to other programs that NORCOR offers, which include substance abuse treatment, anger management, parenting, job readiness, and cognitive behavioral therapy. So they have a very robust system of programs at NORCOR. And again, this is an issue with your facility. There's simply no capacity or ability to provide these types of programs at the Benton County facility. There's no space. It simply can't be accommodated in that facility. So the only program services that are provided really are at NORCOR. Yeah, any questions about the data? All right. Oh, sure. Mm-hmm. Well, it depends on how, in terms of mental health. Well, it's difficult to say because they have a different profile. They're sentenced offenders. So they've been in jail for a longer period of time. They're going to be in jail for a longer period of time. A pretrial offender may have the same mental health needs, but they're not going to be sent to NORCOR. So you really can't necessarily say that.
Well, I should have been more specific. Those that are in NORCOR, how do they? Oh, sorry.
Those that are in Norcor, how do they compare to the rest of that jail's population?
We don't know what the profile is of
Okay.
program need for the people in the Benton County Jail because they don't receive the same type of assessment. All we can...
I'm just talking about those that are in Norcor.
She's talking about all of the inmates in Norcor. How do the Benton County inmates compare to the...
We can ask. We don't have that
Okay.
data.
Okay, thank you.
The question is, what is Norcor?
Northern Oregon Correctional, what's the acronym stand for? Regional Correctional.
You could say more about it. It's a 4-county regional jail in Eastern Oregon.
In the Dalles?
The Dalles.
Yeah. It's about 3 hours away.
Got a question back here.
Yeah, I had a question about when you're talking about reported crime arrests.
Yes.
Where do municipal misdemeanors violations fit in? And where does the municipal court citation all those simply Benton County Circuit?
These were, again, these data were from the circuit court. They're more serious offenses, so this doesn't capture all the traffic offenses and lower level municipal offenses.
I asked if a certain amount of understanding what goes on and the impact on further up the system and the jail itself has to do with dealing with behavioral crimes.
Yes.
And there's a substantial number with no, and I'm trying to understand data on the impact to the city from not having.
They would be included, the offense data and the arrest data would include misdemeanor arrests.
Even though there are arrests that go to the municipal court, not the misdemeanors that go to the municipal
That'd be
court.
a citation and release.
So that would be count. Oh, I'm trying to understand what happens if someone gets a citation for drinking on a sidewalk. What happens to that? And is it in the data you have?
That is in the data we have. They would have a citation and told to show up to court on a certain date or to pay a fine.
But that's to municipal court, but you don't have the data on the municipal court.
We have the arrest, well, we don't have two different, we have arrest data from the Corvallis Police Department and the Sheriff's Office, which would capture how those people come into the system. We don't have municipal court data in terms of their outcomes. Yes.
It doesn't pick up on the recording unless you're on the mic.
Thank you. My question is in regards to, there was a slide that showed the 23% increase in arrests and the numbers between Benton County, Corvallis, and Philomath. I was just curious if there's any data showing how that relates to population. Has it grown faster than population growth?
We took a look at,
fast?
we did take a look at that, and it's been very stable. And the reason I didn't put a chart up is because it's basically flat.
Okay.
The rate's basically flat.
And then in regards to the different populations of Benton County as a whole, Corvallis and Philomath, is there any relative data to that? Does Philomath have a larger amount of arrests per population, for example? Not that I think they would, but.
They have a very small population. We did not look at that. We can certainly take a look, though.
Okay, yeah, that'd be great.
Okay.
Thank you.
I realize you're in the early phases of, or in the midstream of this, but I would like to have seen more participation with the school system, with juveniles, and it seems like you got a better chance of preventing more serious problems with the juveniles if you catch them early in school, in middle school, high school. In fact, I'm impressed with your presentation, and I could even see a course. I wouldn't know what grade to put it at, but I think kids would learn a lot if they just were aware of some of the things that you're you're promoting and explaining. And
well, you know,
I don't know if you're up to that or not.
Yeah, one of the most encouraging data points we saw was that decline in juvenile arrests, which is occurring around the country, but it's very pronounced here in Benton County. And what all the research tells us is that's the early indicator for future criminal activity. So to the extent that you're achieving those reductions now, that'll pay off in the future.
So I'd be curious to have or get more information on the pretrial detentions amounting to 60% of the inmates. I find that interesting. And I'd like to know more about, you know, how long those people are in pretrial detention, waiting for a trial, what the outcomes of those trials are. I mean, the fact that there's more in that system suggests that a lot of those people end up not in jail at the end of the trial, I guess, or something.
And that, yeah, that's a next level of analysis we're going to get into. But certainly, the difficulty in looking at that, if you look at like average pretrial length of stay, you have some people in who have been arrested for very serious offenses, murder, multiple counts of rape, and they're going to be in jail for a long, long period of time, hundreds of days length of stay. The more typical experience for somebody cycling through the jail on a typical charge is a much shorter length of stay, so the average doesn't really tell you that much. It's more of a distribution, but we're going to take a look at that, and we'll get that information for you.
So with respect to mental health, you had the discussion towards the end there, but did you do any analysis or breakdown as to if someone was identified as having mental health issues at the type of crime? So for instance, you broke down property, person, and behavioral. So it'd be really interesting to know what percentage of each of those categories might have a mental health component. I think there's some key information there regarding mental health that could be expanded upon.
Definitely take a look at that. Off to you, Ari.
I always appreciate seeing what happens with the hard data. I have a T-shirt that says "Data rocks." My family tells me to get a social life every time I wear it. But it's so informative. It's also very powerful information. And as stewards of that information, one of our values is transparency. Because I think whenever we release data, there's always questions and follow-up. The follow-up questions are great, and we will look at those that you suggested tonight. But there's always some questions about, well, where did that come from? How did you get that analysis? And so we, as a project team, made a value around transparency. So if any of you in this room want to see all the raw numbers behind any of these charts, we will make them available to you so you can look at the analysis and see how those charts were developed. Transparency and access to information is key as we're consumers of information. So any of you who have access to that. The other pieces I saw, and I'll get right there, a lot of people taking notes and pictures. We're going to make this presentation available on Benton County webpage so you can have access to that. So you aren't wondering, what was that third slide? We just don't want to hand it out because there's a bunch of paper wrestling that goes on all night, and it distracts me, and I'm easily distracted. So we just make it available electronically. Okay. But again, if you want to see more of how this got here, let us know, because you have a right to see what's behind all of this. Yes, ma'am. And sir.
Well, just a quick comment. I suggest you put all your supporting numbers up in Excel spreadsheets on the county's website and just be done with it.
Great idea. Thank you.
I was just going to ask, how would we request that data? Email?
An email to the link on the county website, but I like the idea of just having the Excel spreadsheets available.
Sure, yep, that's good.
Yeah, that's great. Thank you, sir. Carl, you see any? I mean, I'm speaking for both of us, but if I'm saying something wrong, throw one of, no, don't touch any of that stuff. Which reminds me, while we're in this room, in this beautiful museum, which as my birthdays go by, I feel more of a kinship here than I used to. The artwork on the walls is very precious, so for those of you who are standing, if you stand away from the wall, we appreciate that. I was asked to make that announcement, and I forgot, and I don't know if the officer back there was leaning. I'd hate to get you a ticket. You know, I just, especially since I'm driving out of town later. So thank you for respecting the environment we're in. Great questions and comments. I'm ready to move on and segue into the feedback from the community meetings. Are you all ready to hear that part? Okay. It's extensive, broad-based community input. That's a big part of this. Looking at the hard data again, community's responses, evidence-based practices, and pulling it all together in those three options. So we've identified, we have these open forums, but it's a hardship for some people to make them, and there are many people who can't come to a community forum. Work, family, and what it takes to get there does not allow them. So we're trying to go to different community groups where people are already meeting to get feedback, and we've done 10 of those, and there's about another 12 scheduled. We're also going to be attending your fair and talking to people who are there and getting their feedback. So for people who can't go to any community group, there's some ways of getting input, so it can be very broad-based. So I'm going to give you the comments so far is what you're going to see next. And these are the questions in the community meetings. You're going to answer some of them tonight, as this is another engagement opportunity. So it's open-ended. Just give the background on the assessment, and then ask people what their vision is for a healthy criminal justice system for Benton County. And I use that word truly. What does that look like? And that's a great conversation. Get a lot of feedback from that question. Then we ask specific questions about treatment, repeat offenders. If people have even toured the jail, they know what that looks like. So to show you some of the feedback, out of those 10 groups so far, we've had 94 responses. 94 individuals have commented. And I'm going to show you the theme of responses, what they're saying. And you don't know if one person said it or all 94 from a slide, right? So I put a scale on that, so to give you help you get a sense of frequency and how often it's coming up. So if you see a scale of 1, it means between 1 to 10% of those 94 individuals made that comment. If you see a scale of 2, it's 11 to 25, 3 gets up to half, 4 is 51 to 75, and 5, majority, 76 to 100% of the folks at the meetings have said that. Make sense? All right. I hate to say, this is what people are saying. Well, how many? 4 or 400? There's a big difference there. So this helps puts that in perspective. One of the comments, and again, it's high, it's come out a lot in the community meetings so far, is are you looking at the continuum from those people before they get into the system, while in, and after? And as Karl highlighted in the mapping there, that's an absolute yes. This is not an episodic assessment. This isn't went to a menu and pulled one piece out of it. It's full, it's comprehensive. Prevention to reentry and everything in between. Yes, sir. I know, go for it. Can you wait for the mic, because then people watch us later won't hear what you said, and they'll just hear my answer and they'll have no idea if I'm just talking.
Totally. Just to put this into, I guess, context in my brain, I'm wondering, are you able to share with us the names of the groups who are being represented in this right now?
Yes, sir.
Okay.
I actually have a list of them. There's a list. Where is that? Can someone help me with where the list is? What I'd like you all to do is take a look at who's been identified to meet with and see if you would add any names. So that's available visually. I don't want to go through it as a full group because of the time, but I have that here. And would you add any groups that we didn't think of? Because we'll follow up on that over the next month. So thanks for that question. I do want to answer that as we report on the themes, I don't report it by group. So you'll see the group names, but the findings are not reported by group. This is an assessment to see what this group thought and this group disagreed or agreed. That's not the point here. The point is to get as much feedback as possible and synthesize the information. So next theme, people are asking me, are you using research-based or evidence-based principles in your assessment? It's a 5. And they typically give me some suggestions of programs to look at. So I want to hand out my Data Rocks t-shirts to them. As a criminal justice researcher for 17 years, absolutely. Absolutely, we're doing that. We're doing a literature review, as I said, hard data, community input, and a literature review of what works to divert people, crime prevention, divert them from the system successfully, what works for all offenders who are in the system, in building skills and in accountability, and reducing their victimizing more people in the future, and then for people who have behavioral health issues, what helps. That's all part of the literature review and will be included in the report. Are you including the needs of victims? Are your options a balance of what works for these offenders and what makes victims feel whole and safe, and what reduces people in the future from being victimized? So yes, we are. We're meeting with the District Attorney's Office has a victim services section. Are you all familiar with that? And so I want to meet with them first and go over these questions and get feedback and ask them for their insights on how to talk to victims. I've done that before. I mean, how to link with them, because that has to be done very respectfully, and they have to volunteer. So I hope they're a conduit to helping us get to that voice. We're also talking to the domestic violence group and women and see if we can get some feedback from women and any men who might be in that situation as victims. Treatment for offenders comes up high. You can see that's a scale of 5. It's as close to 100% in these meetings thus far. Are we looking at what is effective diversion, providing treatment for people in corrections? Are you considering that? Drug treatment, mental health treatment, education, skill building? Is this trauma-informed care? I feel like I'm back in school. Did you remember to do this? It's like I love coming here. I love these meetings because this is all aligning so far. And I'm halfway through. We are halfway through as a team. It's not mine. I'm sorry about that, y'all. If it continues at this pace, I would say the need, the literature, and community comments are all aligned. There isn't an arm wrestling here. There isn't a, what do we do? People are telling us what the literature says, and it's matching with what the need is thus far. And then with those 3 options, I think will be easier to come up with than if you have very diverging kinds of feedback. But even if we do, we're going to include it. Social determinants of health. This wasn't originally a high focus, and I heard it so much, it caused us to rethink it and include it. And so thank you, public health team who met with me, community members who talked about it, because we have a whole unit in our organization around social determinants. But are we looking, the comments are we looking at housing needs, poverty, employment, education, and the interrelatedness of social determinants of health in a community and crime. So it is part of the literature review to describe that, and we will have local data related to social determinants of health. Thank you, Health Department, Public Health Department, and your epidemiologist for supporting that and supplying it. Part of the team. I just described how we're using that now. How's this pace for everybody? It's good? Are the brownies starting to take effect? You feel like, I need to move. There's sugar, and I'm sitting here, and she gets to move. Equity, I tell you. Juvenile justice, you brought this up, and others have, very high in the feedback. Are we looking at juveniles? Is it part of the scope? And the answer is partially. That full analysis that you see, the juvenile system isn't, the totality of it isn't there. What is there is looking at crime for juveniles, and the juvenile justice system has a very sophisticated use around identifying risk and need. So they have information on youth who have a high probability of committing crimes in the future. Are we doing any outreach to help with preventing that? There's also a lot of data, research for, since I was born way back on these walls when, that shows that youth who have a parent in the adult system have a high probability of being career criminals themselves. Children of incarcerated parents. Very significant. Are we targeting? Are we doing any cross-management between systems for its family, wrap around that way, and not waiting to see what happens here? That's prime soil for prevention. That also comes up in the conversation around NORCOR. What happens when that member is so removed from family who can't get to see them? I'm not trying to suggest it's this or it's that. I'm trying to point out what we know about the research and the data and what exasperates this problem, what fuels it, what throws fire on that kindle, and increases the likelihood that a vulnerable population are going to act out that way in the community. And there are things we can do to prevent it. So it is included in the study. Training, it's not mentioned as often. The scale is a 2. But what's in place is like a 5+. Let me show you what I mean by that statement. The comment was there should be training for staff, for law enforcement, correction staff, mental health providers, and so people know what works. And there's a couple things going on. The state of Oregon has asked GOBHI to provide trauma-informed care training for all probation and parole officers. Several of us in this room have been trained trainers on trauma-informed and how it helps improve the correction system. We are doing that as no charge to the state. It's through a grant. So a lot of the work we're doing here is through technical assistance that GOBHI actually sponsors. So part of the system will receive that. But more importantly, something's going on here locally that I hear only one other county in the state is doing. And that is the training for crisis intervention teams, CIT. I don't know how familiar you are with that. It's a training based on a national model where law enforcement is trained on how to de-escalate a situation, especially when someone with behavioral health issues is acting out in a way that feels threatening to the community, in a way that may actually be threatening. So it helps them de-escalate. The research around this is phenomenal. It helps reduce the overuse of force. It helps reduce the need for SWAT-like responses in the nation. I have an incredible story from a law enforcement officer who went through it. Do I have time to tell you that, or should I wait and see at the end? Do you want to hear? We did this training, and we do it all over the state, as I said, and I got a call 2 weeks later from a deputy. I'm not going to say the place or the deputy's name because I do not have his permission. He called me and said, Ms. Ari, and I love when they do that. Ms. Ari, I'm calling you to apologize. And I said, really, Deputy, what happened? He said, well, when you came and did that training, I thought, I don't have anything to learn from you. I actually thought you were kind of an egghead teaching the class over that university, and you're not on the street with me. You don't know what I'm seeing every day. And you came in after sitting in class, I'm off my beat, I'm here, time away, and you're talking about de-escalating. What did you have to teach me? That's what I thought anyway. 2 weeks after, really recently, after the training, I got a call that someone was on the roof of a building and was going to jump. And I was the first one there. And I went up there and he was ranting, the jumper, attempted jumper, was ranting and raving and going on. And typically, I would be hurried for the negotiator to get there. But something about what I learned that day caused me to listen to this individual differently. And I heard him talking about how he was going to lose his girlfriend because he was going to lose his job, so he wouldn't have his apartment because he lost transportation to work. All of us who lose our transportation to work, many of us, would think of another option. Partner, a spouse, a friend, figure out the bus, call Uber on a phone. But in his mind, and he suffered from some PTSD, so he unraveled quickly when he lost that transportation. It immediately went to, I'm going to lose my job so I won't have a home and my girlfriend will lose me. And he was going to end his life over this. And this deputy who was talking to me said, I called my church. I called the clergy at my church right then and there because I knew they provided transportation for people who couldn't get to work. And he seemed to calm down in listening to that call. And then the team got there and we talked to him about what support. Certainly he needed more help than that, but it turned that moment from him being on the edge to backing up. And I wouldn't have keyed in had I not been in your class, so I want to apologize to you. And he actually said to me, you caused me to raise my I don't give up beep meter. And what's not just going on, but what happened to you. This is a highly successful program. And it has law enforcement and behavioral health working together really differently. And the reason it's hard for law enforcement to get to, because what? It's a 40-hour training. It takes you out of the community. But what's happening in Benton County is your mental health providers, your behavioral health providers have been trained as trainers, and they have a goal of 100% of law enforcement will receive that. When I do the trainings around the state with our team, it's about 35% of the team will say they could get to the training. Your goal locally is 100%. The care here and the efforts to make it work are not the issue, as I look at it. It's how do we bring it together differently for the next generation around corrections, ladies and gentlemen. So I hope you're okay with me taking that moment to tell the story and it was worth your time, because he touched me really. Yes, ma'am.
Is it all law enforcement in Benton County that's being trained by the behavioral health staff?
Who has that answer? Is it all law enforcement or certain police departments, SO, sheriffs? Do we know who's on that? The goal is everybody. Thank you.
Okay, thank you.
Everybody. I've been asked to speak at the CIT National Conference in Seattle next year. We're going to highlight what works, and I'm going to talk about you all. Your ears are going to be ringing. Another question or theme that comes up very often is asking about perceptions of if national issues have an overlay locally. So specifically what people are asking us are there overrepresentation of ethnic minority youth in the system? What about law enforcement responses? What about treatment of individuals who do not have documentation? What's happening there? We know that these are very significant national issues, and sometimes as I hear it, there's a perception if it's happening across the nation, it's happening here. I don't know. We're looking at the raw data to answer that and talking to individuals to get their perceptions. You saw the jail data that showed that at 5 people, actually at 2, you're going to have an overrepresentation issue in the data. My questions is, what's the equity in responses? Lengths of stay longer? Access to treatment different? Or all else being equal, are you having similar kinds of numbers show up? So we need to take a closer look there to answer that. Kind of have that. People ask about, well, what about the monolingual Spanish-speaking communities? How will you get their input? And we think it's important as the comments, and so do we, absolutely. We're going to hold 2 forums in Spanish, and we're looking at working with your local community members on how to engage people from those communities to the meetings, or do we need to go somewhere different for them? Dr. Ramirez is here tonight. He will be leading those meetings. And I don't say that only because Jorge speaks Spanish. He has insights both personally and professionally on cultural engagement, on equity issues, his professional career that I so admire. That makes him more of a full human than, hey, Ari, did you get someone who speaks Spanish? No, I respect you all too much to answer yes to that. So I'm really glad you're part of our team. Beds in other communities. This does not come up often, but the comment is interesting to me. It has a 2 on the scale, but the comments have been the Benton County community is not engaged in a conversation about using beds in the Dalles at Norcor. And there are many implications for families. What does it mean for victims? Is cost. Are we talking about that? And so far I don't know the extent to which that's commonly known. Should probably include some of that in our analyses. Yes, ma'am.
Just as a comment, it seems like that would also be similar issues facing families of people who are sentenced to prison as well, because the majority of the prison bed space is in Eastern Oregon as well.
Yes, that's true. Yes, access, visiting, children of incarcerated parents, whether jail or prison. The prison system is outside the scope of what we're doing here. Obviously, there isn't a Benton County prison, or I would have thrown them in here to have the same darn conversation. So yay. Cost. People have asked, will cost be included? Absolutely. You saw how we're synthesizing all this information, hard data, your feedback, the literature review into 3 options. Those 3 options will include a cost-benefit analysis for each one. Carl, am I over-promising you yet? Okay. Because my CEO gets enough letters about me. I don't need, dear Mr. Campbell, Ari has continually promised things I'm not going to deliver. But he is, and we are, and that's why he's up here. Origins of the assessment, that's come up every time. I think there's history here of different things being put before the community, and I get a lot of why this, why now responses and comments, and good for people for asking. I would too, if I was wondering what's happened here. What's a genesis? Well, the genesis is there have been previous studies. They've been very single-focused on a part of the system. Your county commissioners took the leadership and said, people do not have enough, our community, does not have enough information about the full continuum and the different levels of information I'm talking about, and put out an RFP to have that done for your community. Okay. We're going to switch here. I'll just stop and see if you have any questions about the themes and things that have come up. Okay. Yes, ma'am. Commissioner, yes, ma'am.
You're collecting information from a lot of people, but is there an online survey, or is it always in person?
No, there is an online survey. Thank you, Commissioner, and it's on the Benton County webpage. Leah, you want to tell people exactly how to access that so they get it? Good. Thank you.
If you picked up the flyer in the back of the room, you'll see the URL on the bottom of this flyer that has the color visuals. And then if you picked up the feedback form that looks like this, the URL is at the top of the page on this piece of paper. And if you picked up the agenda for tonight, the URL is on the top of this piece of paper.
So we're going to switch. Oh, I'm sorry. There are a couple more hands. I'm not going to switch yet. We're not going to rush you.
Thanks. So when the theme represented was, are you considering the continuum from prevention to reentry, the answer was yes. And so I wonder if you're going to have time tonight or if it's later to talk about what's included in the scope of what's counted as prevention, because as soon as you do consider the social determinants of health, it's all of us all the time, right? The health of the community is sort of every positive input is. So just if you're at a point where you can talk about what scope you're thinking of when you use the word prevention.
Yes. Not with the data information yet, but only the plan for collection, so the scope of collection. And some of that is in the conversation around the social determinants of health, ACEs scores in the community, exposure to trauma, the extent to which evidence-based practices for crime prevention exist are all going to be part of the review, the narrative. And so that's more of the scope.
Thank you. Is there a possibility of also including evidence-based practices in school discipline?
And what happens in the schools,
Right.
you know, I hadn't thought about it in terms of discipline so much as how is it the schools you can identify with a pretty high rate early on what youth are on the trajectory towards that,
And then what programming
and then
they
what
have in
works
place.
to help prevent it.
Okay.
So that level.
Thanks.
So discipline or not, probably not going to talk
Yeah.
about that because it's
big.
Yeah, well, it's not only big, but I want to have concrete things that people can work on that make a difference, and pinning it on that is misguided.
Right.
And, yeah, I just don't have that. Thank you for the question.
Yes. What is your time horizon for your cost-benefit analyses?
And we're going to have a chart that shows the next steps and when you're going to get those three options.
But I mean the time horizon within the studies.
Time horizons within the studies. Carl,
How many
do you want
years
to?
out are you going to be looking at the cost-benefit analysis?
Carl, let me see if I paraphrase this correctly so we're answering the right question.
All right.
In our cost-benefit analysis, are you asking what time frame that's going to include, like the cost-benefit over the next 3, 5, or 10 years?
Yes.
Did I interpret that? Okay, Carl.
Correct.
Well, to the extent we're looking at any type of long-term solutions here for the county, we want to take a look at a reasonably long time frame. So our standard approach is to take a 30-year look, full life cycle costs for the operation of, for the full implementation of any option that's under consideration, both capital and operations.
Thanks, Carl. That mic became a hot potato for me. I have no idea. That's why we're a team. Was there another question before we? What we're going to do next, because we're going to get some of your responses, even as we get towards this question, we'll do one more, but to let everyone know what's going on in order for this participation part, we're going to do some instant polling where you point on the clickers and you vote on some things just so we get a flavor for the room. So we're going to hand out the instant polling pieces now, and I'm going to ask you to please don't punch it because they're all are on the right channel. So if you try to get I Love Lucy in Portuguese, you're going to mess with me. So just hold on to them for a minute, and we'll talk to you about how to use them. There's a test slide up here where you get to practice. So you were patiently waiting, sir. Thank you.
Just a quick question, though. What kind of a discount rate are you going to use? Testing. Am I clear? Okay. What discount rate are you going to use in your cost-benefit analysis, your net present values?
What discount rate?
Yeah, I know. That's...
Yeah, for your equations and your algorithms on that, Karl.
But that's awfully important. It needs to be addressed.
Yeah, that's very important. And I'm not prepared to answer that at this time, but we'll consult with our statisticians, and we tend to be very conservative in terms of our assumptions on net present value calculations.
Okay, you also might want to talk to Pat Cochran about what the marginal cost of capital is in this county. Right, he's the budget guy. And I'm sure he has people working for him if he doesn't know himself.
Good suggestion.
Okay, so we're moving to these voting pieces. And we're going to have a bit of a conversation together, too. These are a way to springboard the conversation. Tina, as the charts pop up, will you grab it just so we have a check and balance on the technology? The thing I see about these clickers is they feel like my phone. So please, as you get up, don't treat it like your phone. Because again, my CEO counts stuff. He'll ask me what. Okay, so let's, in addition to the community forums and these meetings that we're having for community engagement, we're going to hold 2 workshops on particular themes. So you saw those themes: offender treatment, victim needs, prevention. There could be others ideas. So we're going to hold 2 workshops on one of those themes each and do a drill-down conversation with community members. Because in an hour we can do so much. We want to do a more detailed conversation on 2 topics. And we haven't decided on those topics yet. So we're going to ask you to help us with that guidance towards what seems important. Let me show you what I mean by that. First, we're going to check out the clickers with this question. Which is your favorite Beatle? John, Ringo, George, Paul, or what's a Beatle? So if you feel like, and I should say first of all, right, Jen, we are all on channel 41. You should see that. Can they press any button right now to see it?
Yes, you can press any button right now.
You're on channel 41. There are people here to help you with these things if it seems a little awkward.
And if you don't think you're on the right channel, just raise your hand and we'll have someone to come help you.
So if you think it's John, you're going to press A. If you think it's Paul, you're going to press B. My niece actually asked me what a Beatle was. She's not on my Christmas list this year. I don't know what happened. So go ahead and vote. You just hit A, B, C, D, or E, and it goes. You don't have to hit anything after you hit the letter. It just goes. So far, I've heard from 49, 50 people. How many people were in the room? How many clickers do you know? It's about 52, 53. Okay, so we are going to close the polling at 51 responses. I always like this part because I get to say, survey says. I don't touch it anymore, right, Jen? Or I hit it. Hit enter. All right. So, favorite Beatle, 33% of you think it's John, 18% Ringo, 27% Paul, and 12 of ya know my niece. See how this works, the voting? Any problems with it that we need to work out in the test before we get to the actual questions? Good? Okay. So here were, what did I do? Here were the themes that I just went over with you. A was research on what works, including treatment. I'm asking you, the question is, what should we hold a specific workshop on? So if you say A, you're telling me, I think my #1 answer is that research on what works, including treatment. B, victims' needs. C, jail issues, including the renting of the other beds. D, you should have a workshop on social determinants of health and let the community talk more about that. Or juvenile justice is an E, F is training, and G is more of a conversation on national issues and the extent to which they're present here. So please vote on one of those. There is just one. There are two workshops, one topic each. Just vote once, because I'll see what's first and second. Okay? We got 43, 45 of you. Okay. Everyone good? You ready? Let's see what you think the workshop should be on. Don't touch anything. We're really close. Research on what works and jail issues, including the renting of beds. The next highest is social determinants of health, and then everything drops way down. We may have 3, Commissioner. 3. Okay. Well, they're so great on what that cluster around. Do you know where? Okay. The next question. What do you think of this? Is this interesting? Yeah. Okay. Your thoughts now on the questions we're asking at the community engagement meetings. The first one is fixed, but we'll talk a little bit about more of what you're thinking based on your answers. So what's included in your vision of that effective or healthy Benton County criminal justice system? A is a focus on crime prevention. B, lock them up only. C, treatment only. D is a balance of corrections, the lockup and the different parts of the system, responses with treatment for offenders. E is, you know what, I need more information about what works before I answer this, Ari. And F is, I'm thinking of something else in my vision. So please vote. Okay, we ready? All 51 have responded. Wow. Balance of corrections and treatment. By far. Some folks want to talk a little bit about what you were thinking. And I'm not going to put anyone on the spot, but in terms of that 63%, you want to share what you were thinking on that and why you would include that as an effective part? Yes, ma'am.
For me, I see corrections as an issue that you need to do with treatment. I think that you can't do one or the other. I feel like having that balance is really important. 1, for the accountability, and 2, for the rehabilitation. So that's just what a great summary. Rehabilitation and treatment. Thank you.
Thanks for doing that. Anyone else want to comment on? Yes, ma'am.
For me, it says that we have to have a jail here that's big enough that we can have treatment services there.
Thank you. The size and what's done there go together.
I agree with that last answer, but I also think that we need to make sure we include a support system after they've been in jail, possibly gotten some treatment, and that they have the support system to continue writing what they were in to correct.
Ongoing in that reentry piece. That's key in the research, what you just highlighted. Just key. Any other comments? How about anyone who said focus on crime prevention? A little bit about what you were thinking? Okay, I have one here and then Jen in the back.
Criminal justice systems are expensive. If you can prevent the crime, then you can avoid the cost.
High return in community safety and cost with prevention.
Well, I see there's a choice up there that I think is very important, and that is that the criminal justice system cannot stand alone. It has to tie in with the mental health, particularly addiction and things like that, and it's not up there, but I think it's very important.
Yeah. That corrections, balance of corrections responses with treatment for offenders is what you're talking about. Does everyone have that handout that asks these questions? So other things that you'd want me to hear, or us, the team, in your thoughts about this, please write them out. If you had other, what that is, so we can still get that. And I want to get through a couple more of these. Is that okay? I want to rush you, but I also want you to get a flavor of all of them or get a flavor of your responses to all of them. But I don't want to cut you off so you have room to write to get that information to us. Why do I do that? What do you consider important elements of treatment for offenders, if any? So the first one says, I do not support providing treatment for offenders. The second one is B, substance abuse treatment. C, mental health treatment. D, education attainment. E, employment and supporting getting a job. F is skill building. G says everything from B to F. It's all of the above except A. And H is, you know, I think some of those are important, but maybe not all of them. So please vote on that. Okay, we ready? There we go. Everyone's up there. Done. B through F above. Karl, your options are going to be easy. Maybe not the funding and how that all works, but in terms of agreement about what's needed, this is just percolates to the top in so many of my conversations with your community. Here's just some yes and no. Oh, sorry. Thank you. No, that's what we're here for, so.
So just because there wasn't much to differentiate in that last one, I just think one of the great things about having some people paid to go through the literature is that it would be great if the recommendation reflects all of those are somewhat important, all of those presumably have been linked somewhat with reduced recidivism or prevention, and so weighting those for us, I mean, would be a really helpful part. We all sort of intuitively think, well, yeah, jobs, well, yeah, skills, you know, yes, drug treatment, but we're not going to go sift through all the studies that show us what kind of return we get on each of those.
We are. And so you'll see that. You'll see the community's comments and then what the literature says. And as I said earlier, it aligns so much. But you'll see the data and the research behind it, which, by the way, is research for over the last 45 years now. Yes, sir. No.
And all these factors are kind of interrelated anyway. I mean, if you don't have a good mental health, it may be because also then it prevents you from getting a job. You might slide down. So how do you say one of these is more important than the other?
There was a time where we did. I'm saying we're not in that time anymore, but I don't want to make that assumption about community members. But you all are telling me that loud and clear in every visit here, sir.
Before we vote on this, could you explain to me what a work release center looks like?
Yes, and thank you for that question. So the work release center is people who are in the jail leave for the day to be able to work. They go to work. This isn't the community service kind of cruise that you see while they're still in jail. They go during the day and return to jail at night. So it keeps the continuity of employment. It keeps, you know, a lot of things in place. So that's what a work release center is. So if you're ready to vote, A is yes, we should have one, and B is no. I'm so glad my daughter didn't have this while we were growing up. No, Mom. No, Mom. No, Mom. Where's the mute button? Okay, let's see what you all think of this one. 92% yes. That's really high. I'm going to move on to the next one, a sobering center. So what happens when law enforcement pick up someone who's intoxicated? And they have two places to take them in, and very much so they have to go to the hospital, the ER, safety. Are they fit for jail? Is alcohol or drug level so high that it's unsafe? And they wait in the ER with them. Right? And people, very often, the two places where people are picked up and taken to, if they need to be taken, is an ER room or jail. And if they're highly intoxicated, they can't go to the jail. They have to make sure that individual is safe. They have to take them to the ER. A sobering center is a center where you take intoxicated people to sober up. It's secure. They get assessments while they're there. They get treatment to help them, stabilize before we start doing any kind of screening on them. Does that make sense, the description?
Relieve the responsibility of taking a drunk person to the hospital.
Yes, and some sobering centers have law enforcement there 24/7 too, so there are different ways to make it do the security part of it. It's not, this is your issue. It's a highly staffed and secure center. So yes, sir, it would relieve that pressure on the ER, absolutely.
Do sobering centers have medical staff on all the time?
Janet, you've working and you've looked at several of them, so I'm going to turn to you, who is the director of our Center of Excellence. I introduced you before you weren't here. I said you look like me without glasses, taller and younger. So there she is.
Thank you. Yeah, there's different models of sobering centers across the state right now. Some do have medical staff attached, usually RN level. Some do not. And so it would really be up as a community to figure out what your need was and staff that then appropriately, depending on what you thought the level of intoxication and sobering that you wanted to do in those facilities.
Thank you. So do you all think it's important to have a place like that, although you need some more details on what it might look like, but having that as an alternative to the ER? If you'd vote on that, please. Pardon me? You did it already. You're ahead. We're almost there. Okay. 90% yes. Yeah. Really looking at that relationship of treatment, corrections, and places to do that. What other questions? Do you think it's important to have a drug court program? Drug court is a program where it's a specialized docket for offenders who have substance abuse issues. They provide wraparound services. And by wraparound, I mean look at all the needs of those individuals and connect them to appropriate support. It's under a judge's review regularly. It's a pretty intensive program.
When you say drug court, are you specifically talking about prescription drugs, or are you including alcohol?
Drug court are for offenders who have substance abuse problems of any kind. Alcoholism, opiates, meth, under there. So it's whatever drug addictions they have, they're part of this specialized court. Yes, ma'am.
But we're talking specifically ones that have drug problems who have committed a crime.
Yes, ma'am. Yes. So they would be otherwise in the correction system. This puts them in a court docket, a specialized court that reviews and supports their treatment. Does that help? You ready to vote? Guy? No. Maybe it's me. Okay, thank you. Okay, let's see what you all think of that. Yeah. A lot of ideas on what will work. Have you toured the jail? Have you literally, not on TV, saw something on the news? Have you gone to your jail and toured it? Gone in and had the sheriff's staff walk you around it? I'm curious how many people in Benton County have done that. So yes or no on that. A is yes, B is no. What do y'all think is going to happen on this one? 62% of you have. 62% of you have. Yeah. No, we didn't ask for other reasons. That was just a tour. As you leave tonight, you may want to walk a little bit behind this gentleman. We knew that you guys here were going to give me a hard time, right? Okay. Are you familiar with the early release matrix process and what happens at the jail in terms of needing to let them go early? Is that a familiar process to you all? Oops, I almost hit enter. You're not done voting. I see the numbers of people who have voted, so I know when you're close to being done. About half and half. So as we talk about those data, Karl, we may want to put more in context of what it is that means. What is the matrixing system? Well, and it showed in some of the data earlier tonight, they called early releases. There are people who otherwise would have been in jail longer but had to leave to make space for other offenders. So they were released early. It's called matrixing them out. And what you saw in the data are the number of people who've been matrixed out several times, multiple matrixing. So what does that mean? They were let out early. They did something else to send them back to jail. They were let out early. So victimization that occurs during that process. No. There is criteria. There is criteria. And sometimes when you're looking at 10 of the worst, which 3 need to leave? That criteria becomes a little bit harder to wrap your arms around. I have some other, I don't know that we have time for this, do we, Commissioner? I should probably wrap up because those are the major pieces. Help me understand. So you had, thank you. You had some, Jen, I'm going to need your help. You had some fixed ideas for other topics. The reason they were fixed is because in your community meetings, we heard these themes come out. And I said, well, here's all the things that have happened so far. Which ones would you all suggest we do in a detailed workshop? And they were fixed. I'd like to know, are there any other topics you think should be in a community workshop? And again, that workshop is drilling into the topic in a community discussion. And we'll vote on that too. So some ideas. Go ahead.
So I am a restorative justice practitioner, and just in context, basically, our current system does not truly take into account victims' needs. And everything that we've been talking about today has really been very offender-focused, which is, I mean, we're talking about jails and offenders, but I'd like to see some more conversations around how do we truly weave in victim needs into into creating a criminal a justice system.
So the first one, you're doing that offline. Okay, so the first one is around including victims as what are the needs of victims and how do we include them in a restorative way and have a discussion on that. I want to highlight, not to negate what you said, restorative justice has great research, by the way. It's going to be included in the study. All the discussion around offenders is to, one, help their quality of life, but to reduce them from victimizing more people. So in essence, we are talking about reducing victimizations and helping. But for people who've been victimized, what do they need for restoration? Absolutely.
I just want to add, because our current system creates obstacles for offenders to provide healing because victims have kind of been taught that what they need is the bad guy's locked up, that, you know, so that's, again, where I'm going.
Thank you. Yeah, great addition. Somebody else. Yes, sir.
I'd like to see community-based restorative justice for youthful offenders.
Such a great program. Other ideas for community workshop topics that we haven't already covered tonight? Did we miss something else? Yes, ma'am.
I think it'd be interesting to get some perspective from students at OSU campus. I know that young people have a hard time becoming aware of these kind of issues, so trying to get at that community, I think, would be really useful.
Okay. So a community engagement on campus or a workshop around the needs? Which one are we?
Maybe a little bit of both.
A little bit of both. Okay,
yeah.
so include it in here. Thank you. All right, 3 ideas of other workshops. Anything else? Do you have it ready, Jen? You have an idea, sir? We will. Let's close at that. If not, well, we're all up front, but he'll stay for a few to do that. So I'd like to stay on topic here if it's a particular question for Karl. Oh, no, he's probably, I don't know what he's doing, but probably. There you are. So, Karl, we're going to have a question afterwards for you. Yes, ma'am.
I'd like to explore some examples of communities that have really good programs for helping those out of prisons reconnect with the community?
Okay, great. Thank you. Marion County does too. So we have some examples you're telling us. Okay. Okay, let's see if, and some of these will be in the research, of course, but let's see, in terms of what you think for adding that to the 2 other community workshops, or 2.5 that we came up with, and we were waiting for it to link. Okay, so A is around victims' needs and restorative services for them, restorative, coming whole again. Community-based restoration services or restorative services for juveniles. Community engagement and training with students on campus, and exploring what works in terms of reentry. So A, B, C, or D, please vote. Oh, you mean, could I be blocking you? I don't know. No, the receiver is right in front of you, so that wouldn't. The polling is still open. I can see that. All right. Oh, not everyone has voted, so I'll give you another second here. You ready? Okay, let's see what happened with On Your Fly. Reentry, really high, followed by the restorative justice overall and for juveniles. Okay, we'll think about it. I don't include that. I think the next slides and the next voting are around the did you know. So I'm just going to move through these rather than the vote for the sake of time. You've already been here for the amount of time you thought, but I just want to expose you to this information. You'll see it on the internet again. We're going to ask you to, in Corvallis, this is how many police officers are on duty at any one time. A, 15, 5, 28, or 10. You can just guess what you think it is. The polling won't, 5. It's 5. Yeah. Of the inmates in 2017 at your local jail, how many filed a grievance over the course of 12 months? 500, 7, 900, or 75? We're not going to vote, just again for the sake of time. You can think in your head what you think the answer is. 7. Yeah, there is a mix of it. What is the number of diversion options offered by the district attorney's office in lieu of incarceration? So how many of those types of options do they have? A is none, B is 5, and C is 10. So I'll wait. You all seem to want to vote on that. I'll hang out. Where I wish the district attorney was here and he could name all of them. Drug court would be an example of an alternative. So it's 10. There are 10 options in lieu of incarceration. So people who think the DA is hurry and get to jail, no, they're looking for ways to make a difference early. As a matter of fact, you have a lot of dedicated corrections staff who do that. And many technical assistants around the state and now other states, your sheriff and other people speak highly of all of this. Yes, ma'am. I'll have to take a look. I don't think there were that many in other places. They might have early diversion, but not once it hits the DA. But I need to look at the data to answer that directly. So let me do that.
Sure. My question for the record on the microphone was if that was on par with other counties.
Mm-hmm. That benchmarking. And how many times was Benton County Jail closed last year to new arrests? Now, these aren't people being matrixed out to make room. These are people who are supposed to come in and there's no room at the inn kind of thing. Did that happen 5 times 50 or 29? Oh, you might have seen. So it's 29 times. And in terms of what's coming up for the future, next steps with all this information being the hard data that's being collected, all the community feedback, literature review of what works, synthesizing into those 3 areas. The options, Karl, we're looking at late August, early September for those to be out, so we're on a pretty fast track to collect more information from the public, complete the literature review, and of course, complete the data analysis. In closing, I'm going to close how I started, which is a lot of gratitude for all of your time, your thoughts, your comments, your suggestions in guiding this and helping us know where to take it in future steps with the community. Comments to Karl for what other data. Please take time to look at the map so you can see the level of detail that's being collected. And I really appreciated the conversation with you all. There's a comment, Jen, probably around the clickers. Oh, thank you. I thought we had that as a handout. Any other comments in closing? Commissioner, you let us off. Would you like to say anything in closing, please?
Thanks again for coming tonight. For those of you who don't know me, I'm Zan Augereau. I'm the newest commissioner on the Board of Commissioners and very much enjoying the role. If you have any additional comments, please either go to the website and give them to us anonymously, call me, write me by email. We would be glad to take any and all input and at this time in the process. Thanks again. I really appreciate your attention and all of your input tonight.